Okay, so what does it mean if you take blood pressure at a doctor's office and it's always high, but at home it's normal? It means you have white coat syndrome. Very real entity. White coat syndrome is people get nervous going to see a doctor. And when you're nervous, your anxiety is higher. That generally what happens as a consequence of that nervousness is you're making more adrenaline and noradrenaline. These are the stress hormones, and they drive up your heart rate and your pulse and your blood pressure. So if you're in the doctor's office and you're nervous about doctors, as a general rule of thumb, many people are, your blood pressure could be higher. A lot of times when you go into the doctor's office, they take your blood pressure the proper way, they take it improperly. And I see this all the time. I would train the nurses how to properly take blood pressure. And a lot of them coming into the class, they were doing it completely wrong. And I've even seen this in hospitals when I'm advocating for patients. And I'll go in and I'll watch the staff come in, the assistants, the nurses take the blood pressure. And it's like they're not positioning the patient properly. If we could pull up that video on how to properly take blood pressure, you should watch this video so that you could get a great understanding of the proper, so one, you have to be at rest. Two, you have to be seated properly. Three, you want to take it in your left arm. Four, your left arm needs to be at the level of your heart at rest, resting on something level. And you want to take it away from consumption of caffeine or other stimulants so that you get a true read for what your resting blood pressure is. Remember that blood pressure numbers are based on resting numbers. They're not based on you walking through a doctor's office and then getting your blood pressure immediately taken. They're based on resting. So you should be sitting for 3 to 5 minutes at rest before you make an attempt on blood pressure. And a lot of times in the doctor's office, they have you going from one room to the next, and then somebody immediately comes in and they don't position you properly, then they proceed to take your blood pressure. And so you get a blood pressure that's 5 to 10 points higher, and now they want to put you on medicine.